Our health is influenced by many things, like healthy food, secure housing, or access to healthcare. Those without adequate housing or employment, or who struggle financially, often have worse health outcomes. Community health workers provide critical support to those in underserved communities.
Community health workers are a key part of the healthcare system or the healthcare team. They work with members at the one-to-one level, and what they do is support them by assessing and addressing their social economic needs.
One of the taglines for community health workers is they are oven from the communities they serve. And that is so important.
Community healthcare workers are those frontline, boots on the ground folks who get in with the community and the people that they work.
Somebody who puts their heart and to put their passion just to make sure that others are getting what they need.
Community health workers are trained health professionals who help connect residents in underserved communities to resources. By helping clients obtain resources such as utility and rent assistance, healthy food, medications, transportation to medical appointments, their health status is often improved. Community health workers bridge language and cultural barriers to help clients communicate with care teams and follow through with their care plans.
Most of the time, community health workers have something very special, which is that they understand they have been in the community they serve, so they're able to relate with those that they're working with. What we have been advocating for is to bring that one-to-one level of care, to bring that connection between individuals and that trust that has been lost for many years.
And our goal is to really bridge those gaps where families are encountering barriers to accessing health services. So our community health worker spends a lot of time listening to the family first to understand what they need. And then from there, they begin to build, I think, a level of trust that allows them to help that family.
They are the ambassadors of health. You know, they just have a good understanding of the medical system, the social system, and also the clients in the community. So that's what, to me, a community health worker is.
Most community health workers are lay people in the community. We just are connectors. It's always good to have a peer, someone who's been there, who knows you, your community, your language, so to speak, whether it's literal language or, figuratively, where we're from.
Both Kansas and Missouri have established CHW certification programs, and in the Kansas City area, more than 20 organizations work with CHWs to improve the lives of their clients. CHWs work across the whole system, from hospital emergency departments to community organizations that provide social supports.
Do you want all families of all children to be able to access healthcare services in a timely manner and in a way that prevents problems from happening? And if you can answer yes to that, then you really want more community health workers.
There is a lot of evidence, research, and at the local level and at a national level, at a global level, that the role of community health workers is very important. They can have great impact on health outcomes because they are taking care of those socioeconomic factors or addressing those socioeconomic factors that clinical providers or the clinical team are not able to address on a clinical setting.
Community health workers can often get to some of the root causes of our illnesses that are, beyond the surface. Because we build those trusted relationships, we can find out a little bit more about what's going on at home.
When a client is struggling with their needs, sometimes they are overwhelmed. They feel like they fell through the cracks through the system and no one is helping. So when a community health worker is working with clients, they just get together in the client's house, right? So you are safe, you're in your own spot, you're in your own place. And it is that relatability that makes the client feel comfortable and they open up.
Community health workers are very much naturally, culturally competent. They are culturally humble. And they use those skills to advocate and protect the individuals that they work with. And also, I think it brings a lot of value for the provider. They are actually making sure that what the provider is saying, either in the same language or in another language, is being understood. So when the client or the patient leaves that office, the community health worker, the patient, and the physician are in the same page that is understood what is expected from the member.
At the end of the day, it's not just the CHW who has to do all this. The CHW is the person that can open or lead the client to the door, but the client is the one that needs to open that door and just making sure that they follow through with the plan and everything. So,
Community health workers are in the right place at the right time, in clients' homes and neighborhoods, to help people self-manage their health conditions and improve their health outcomes. CHW's work complements and supports the work of physicians, nurses, and social workers.
The favorite part of my job is just connecting with people. Love to see the aha moments. Love to see, people's like, I did it. I'm doing this. Yes, you did, and yes, you can.
we are just making sure that all the clients are becoming more self-sufficient. So that is going to help now and in the future, because if you train people on how to do those things on their own, that's magic. That is going to make sure that people is not struggling in the future. We might struggle with resources, but they will know how to get there when the resources are there.
It's an emerging role, and it's an exciting time to be talking about it, because I think it may be new to you, but it will undoubtedly become a familiar term, I think, over the next 5 to 10 years for a lot of people. I hope so. If it was up to me, we would be inserting them everywhere, in schools, in clinics, in churches, not just in emergency rooms and acute care settings, but we really need our community health workers everywhere we are. So.
Community health workers bridge gaps in our healthcare systems, providing better health outcomes for our family, friends, and neighbors.
One of the things that I think we're slowly, very slowly shifting is to the understanding that we have been paying for to fix things that are already broken. And we have done very little as a healthcare system to work in prevention and management. So if we know that and we can intervene early on time, we will be saving millions of dollars to the healthcare system. And we can do that by investing on a workforce that can do a lot of that work. And we are not there yet, but I think we will be there soon. Yeah.